Hey there YouTube fam, did you know that up to 80% of women will develop fibroids by the age of 50? And for some women, fibroids can definitely impact their fertility. Fibroids are non-cancerous growths that can develop in or around the uterus. They can range from the size of a tiny seed to the size of a grapefruit. These fibroids cause a range of symptoms including heavy periods, pelvic pain, and of course infertility. But before we get started with the video, make sure you subscribe to my channel and also click the bell icon so you don't miss any of my future videos. Recent studies have found that women with fibroids are more likely to experience infertility, miscarriage, preterm labor, and also other pregnancy complications. A study published in the Journal of Assisted Reproduction and Genetics found that women with fibroids have a 15% lower chance of pregnancy when compared to women without fibroids. Another study which was published in the Journal of Women's Health found that women with fibroids were more likely to have a cesarean section delivery and also postpartum hemorrhage. Some studies show that subserous fibroids, those that are outside the uterine cavity, have significantly less impact on fertility outcomes. Intramural fibroids may be associated with reduced fertility and also increased miscarriage rates. So we all know the size of the fibroids also has a huge impact on fertility because the bigger the size, the bigger the chance of fertility issues. Pregnancy and live birth rates appear to be low in women with submucous fibroids. Those are the fibroids which are inside the uterine cavity, and their resection has been shown to improve the pregnancy rates. But here's the good news, there are several treatment options that are available for women with fibroids who are struggling with infertility. The best treatment option for each woman will depend on the size, the number, and the location of the fibroids. This is the reason why it's very crucial to work closely with your doctor to develop a treatment plan that's right for you. One of the surgical options is called as a laparoscopic myomectomy, which involves the removing of the fibroids through a very small incision in the abdomen, and a study that was published in the Journal of Minimally Invasive Gynecology had found that laparoscopic myomectomy was associated with an improved fertility outcome in women with fibroids. The study also found that women who underwent laparoscopic myomectomy had a higher pregnancy rate and a lower risk of miscarriage when compared to those who do not have a surgery done. Another surgical option is a histoscopic myomectomy, which involves the removing of the fibroid through the cervix and into the uterine cavity. A study published by the Fertility and Sterility found that histoscopic myomectomy was associated with a higher pregnancy rate in women with fibroids when compared to those who do not have the surgery done. The study also found that the surgery was extremely safe in experienced hands and it did not increase the risk of pregnancy complications. If surgery is not an option for you, there are also non-surgical treatments available as well. A study which was published in the Cochrane database of systematic reviews found that gonadotropin releasing hormone, also known as GnRH, which is a type of hormonal therapy, can be effective in shrinking the size of the fibroids and improving fertility outcomes. This study also found that the therapy was absolutely safe and did not increase the risk of miscarriage and other pregnancy complications. It is also important to note that lifestyle factors can play a very important role in managing fibroids and improving the fertility outcomes. Maintaining a healthy weight, exercising regularly, and avoiding alcohol and caffeine can help reduce the risk of fibroid growth. In addition to all of this, research is currently going on into the new treatments for fibroids such as focused ultrasound therapy, which uses ultrasound waves to shrink the fibroids without any surgery. A study which was also published in Obs and Gynae had found that focused ultrasound therapy was effective in reducing the size of the fibroids and also improving the quality of life in the women who have fibroids. So if you're someone who's struggling with infertility and have been diagnosed with fibroids, don't lose hope at all. Fibroids are a very common condition that affects millions of women around the world, but with the right treatment approach and support, many of these women are able to conceive naturally and carry a healthy pregnancy to term. That's it for the video. Thank you all so much for tuning in. Make sure you like and share this video. Until the next one, see you and have a lovely day.